Hereditary Angiodemna, or HAE, is a chronic rare genetic disorder which can be life-threatening. Being rare, HAE can be misdiagnosed by doctors not seeing the condition frequently. BioCryst Pharmaceuticals work closely with patient advocacy groups and healthcare workers to actively improve outcomes.
Unexplained swellings, excruciating pain, and days spent vomiting or in bed. These can be the symptoms of a condition called hereditary angioedema, a chronic rare genetic disorder. It can affect the face, genitals, and abdomen. Throat or facial swellings can be life-threatening if the airways become blocked.
Globally, HAE affects between 1 and 10,000 and 1 and 50,000 people. It's so rare that misdiagnosis can easily happen.
When I was 15, I had a stomach swelling and my dad took me off to hospital, and a male doctor decided that he would have to do an internal because I was actually having a miscarriage. Had to then try and explain to him at the age of 15, when my father stood next to me, that I wasn't having a miscarriage because I hadn't had sex.
Nikki Bowen is one of around 1,500 people in the UK with HAE, but patient groups think there are more, as it may go unrecognised for years.
I personally believe there's more that haven't been diagnosed, because getting a diagnosis is very difficult. As obviously you know, it can mimic other illnesses, allergies, appendicitis, which my daughter had an operation for appendicitis and it wasn't that. So we are trying to, at the moment, we're concentrating on awareness.
HAE is a defect in the gene that controls a blood protein called C1 inhibitor. Treatments for HAE have now improved, with emphasis shifting from managing attacks to preventing attacks, though patients still face a lack of knowledge when they need emergency treatment.
It takes 10 years before they might see one HAE patient because it's a rare disease. We've had circumstances when our patients carry their medication with a letter explaining exactly what the disease is and what medication they should use. And they've gone to an accident emergency department where instead of administering the medication immediately, the healthcare professionals there have taken a long time to try to fathom what actually it means. And that's because of poor education. And it's inevitable because it is a rare disease.
Nikki was diagnosed early and has a good relationship with her doctor. There's a push to give patients more control of their own care and treatments through shared decision-making.
The medication you're taking now might not be appropriate for the next 20, 30, 40 years. You might want to have children, you might want to have a different career path. Certain career paths will do medicals on you and things like that. So you are better to have that open, frank discussion with the physician to see what is your best path for medication.
Pharmaceutical company BioCryst is working alongside advocacy groups and clinicians to understand patients' needs and support shared decision-making in all healthcare settings.
For us to truly understand how the disease manifests itself and how it affects patients on a day-to-day basis helps us develop drugs to help support them to have a normal life, essentially. Many years ago, there was maybe only 1 or 2 treatments. Now there's a number of treatments in HAE. And having that shared decision-making between the patient and the physician is really important.
The job of a healthcare professional is to provide the options available to the patient and help the patient make a decision which is right for them. What the healthcare professional knows is generic. It doesn't apply to individual patients. So that interaction is really important for the patient to educate the doctor what their needs are.
Like Nikki, Anne's daughter Sian has HAE. They can see things are getting better, but big challenges remain ahead, and the ultimate goal for drug development is to normalise patient lives.
One of the consultants said to me, "You've got 2 choices, Mrs. Harding. You and Sian either control the illness or it controls you." So we chose to control it.
So you must feel quite positive about the future now.
Yeah, on the whole, yes, I do. I am quite positive. I mean, we've moved an awful long way in the last 30 years. And I'm hoping it will continue.